Hello, my name is Jen. I'm a Children and Young People Specialist asthma nurse, and today I'm going to talk to you about the importance of good inhaler technique in children and young people. Inhaled medications are the cornerstone for treating asthma. The most important advantage of the inhaled route for delivery of medicines is that they are delivered directly into the airways and lungs. Unfortunately, inhalation of medicines can be complicated and difficult for many people, leading to suboptimal use and effect. Effective drug deposition into the lungs depends on the type of inhaler device, the characteristics of the inhaled medicine, and on the ability of the patient to use the device. Inhaler technique should be an essential part of any asthma consultation and review. The importance of good inhaler technique cannot be understated. Incorrect inhaler technique is common, with up to 92% of patients not using their inhalers correctly. So why is this a problem? Well, essentially you may have selected the correct drug to treat the patient's asthma, but if this is not delivered correctly, very little of the drug will get to where it needs to be, and it is unlikely therefore to have the desired effect. Poor inhaler technique is associated with poor asthma control, increased morbidity, increased risk of asthma attacks, increased medication side effects, and the child or young person missing out on essential schooling and other activities. There are three things to consider when choosing the type of inhaler to prescribe: the inhaler device used to deliver the medication, the spacer device used to assist the inhaler device in the case of a pressurised metered-dose inhaler, the training and support resources given to the child, young person and their carers. When choosing the correct inhaler device for a child or young person, it is important to ensure the inhaler device is one that they can and will use. So during your consultation with the child or young person and their carers, help them to choose an inhaler device that considers the child or young person's developmental stage, lifestyle, coordination skills and their preferences. Pressurised metered-dose inhalers, also known as PMDIs, are a commonly used aerosol inhaler device. They require good coordination to take, therefore no matter the age of the child or young person, a spacer should be used with them. The spacer is a holding chamber that allows the larger particles of medication in the pressurised metered-dose inhaler to be deposited into the spacer rather than directly into the mouth and throat. They remove the need for coordination of actuation of the inhaler with inhalation, and they improve the amount of medication that reaches the lower airways and also reduce the risk of side effects associated with oropharyngeal deposition. A spacer with tidal breathing is advised in children and young people, as this again improves how much drug is delivered to the lungs. A PMDI and spacer is usually the first choice for children under the age of 12 years. When prescribing in spacers, ensure it is developmentally appropriate. For most children and young people who do not have an issue with coordination and following good training by a healthcare professional, will be able to use a spacer with a mouthpiece from around 4 to 5 years of age. This is important because this decreases drug waste and increases the amount of drug reaching the lungs. PMDI relievers such as Salamol or Ventolin, which contain the drug salbutamol, do not have dose counters. Most PMDIs contain 200 puffs of medication, but will continue to puff propellant for up to 300 puffs. This means that a child or young person potentially won't be getting any medication, which is dangerous in an emergency like an asthma attack, when they require their blue reliever inhaler. Without a counter, it is difficult to know when the inhaler is empty, and simply shaking the inhaler will not help to gauge if it is empty or not. Advise the child and young person, their carer, of this issue, and advise that the best way to know that their inhaler is empty is by recording and tracking when they have taken their inhaler. Please follow the QR code on screen or copy the link to watch a video by Asthma Lung UK on how to use a spacer with a pressurised metered-dose inhaler with the tidal breathing technique. This video can also be used to show your patients and their families to support them in their learning of correct inhaler technique. In children, tidal breathing through a spacer is preferred. However, some young people may prefer the single breath hold technique. This is fine as long as technique is observed and is good. Again, you will find a video on the Asthma Lung UK website to support you in your knowledge of this technique and to support your patients. Dry powder inhalers, or DPIs, are an alternative to pressurised metered-dose inhalers, but tend to be used in older children and young people. Some younger children may be able to use a dry powder inhaler, but you must make sure that they have good inhaler technique at a face-to-face appointment before prescribing. Most children and young people can use a dry powder inhaler with good training from a healthcare professional from around 12 years of age. They have the advantage of having dose counters, and they are more portable and discreet than a pressurised meter dose inhaler and spacer. Some dry powder inhalers can cause a reaction in people with lactose allergies, as they contain a lactose carrier. So ensure you know the allergy status of the young person before prescribing a dry powder inhaler that contains lactose. Some dry powder inhalers can leave an unpleasant taste in the mouth, and steroid-containing inhalers can cause oral thrush. Therefore, advising the patient to rinse their mouth after taking a dry powder inhaler is important, although having good inhaler technique can reduce the risk of these side effects. Dry powder inhalers have a much lower carbon footprint than pressurised meter dose inhalers. In children and young people, it is important that blanket switching to DPIs does not happen. Switching inhalers should be done in a face-to-face consultation with good inhaler technique training, and should be a shared decision-making process between the patient, their family and the healthcare professional. It is, however, good to start to introduce the idea of different devices within a consultation with young people and ensure that they have the information they need to make an informed choice. But it is important to remember that the best inhaler and the greenest inhaler is the one that the patient can and will use. There are many different types of dry powder inhalers on the market, but only a few different types feature on the Humber North Yorkshire Children and Young People's formularies. This is due to only a limited number being licensed to children and young people. Dry powder inhaler devices vary in how they are prepared and loaded, but all require a quick, deep inhalation, and the child or young person to hold their breath for 5 to 10 seconds. It is important to ensure the child or young person has good technique and has mastered this quick, deep inhalation and breath hold before prescribing a DPI. The QR codes on this slide will take you to the Asthma Lung UK videos for each of the devices that feature on the formulary, and will support you with your own knowledge of how to use each of the devices, but can also be used to support your patients with their inhaler technique. Asthma control is dependent on good inhaler technique. Inhaler technique training often needs repeating on multiple occasions, as bad habits can creep in. If a child or young person or their family are reporting worsening asthma control or increased symptoms, always check inhaler technique and adherence to medications before stepping up treatment. It is helpful during a consultation to ask the patient, with support from their parent and carer as needed, to show you how they use their inhaler, and then offer training and support to optimise their technique. Over time, technique can wane, therefore use every encounter as an opportunity to review and refine technique. The training technique videos that are contained within this presentation by Asthma Lung UK are a really useful resource to send to patients and their families to support them in keeping their inhaler technique good. Included in this educational series, you will find a video dedicated to greener practice, but here we discuss some of the key points in relation to children and young people. On each of the formulary guidelines, you will see a green leaf symbol beside some of the inhalers. The green leaf symbol signifies inhalers that have a lower carbon footprint. Dry powder inhalers have a far lower carbon footprint in comparison to pressurised meter dose inhalers, and increasing the use of DPI devices is a key aspiration of the NHS Net Zero plan, but we cannot simply switch children and young people to DPIs without careful consideration. Generally, from the age of 12, most children and young people could be prescribed a dry powder inhaler, but only after a face-to-face consultation with the child and young person and their family, and patient choice should be a key consideration when prescribing any new treatments. Dry powder inhalers can be used in younger children, but this should be assessed on a case-by-case basis. DPIs require a new inhalation technique which differs from how children and young people will have been taught to take a pressurised meter dose inhaler via a spacer. So it is essential to ensure inhaler technique is taught and observed before prescribing. Blanket switching of inhaler devices to lower carbon inhalers is not good practice. Inhalers should only be started or changed when there is a clinical need and following assessment of inhaler technique and inhaler technique training by a healthcare professional. There have been examples of children and young people who have been switched to lower carbon inhalers without an appropriate assessment by a healthcare professional, who have gone on to have an asthma attack and been admitted to hospital. If a change is made to a child or young person's prescribed asthma treatment, follow-up should be organised ideally within 4 weeks to ensure that asthma remains under good control, and the child or young person should be informed of any red flags that would indicate they need to be seen sooner. For example, an increase in interval symptoms, increased reliever use, an asthma attack, or any difficulty in using the new device. Finally, it's important to remember that the greenest and best inhaler is the one the patient can and will use. Thank you for listening to this video. I hope it has been helpful in supporting you to support children and young people with their inhaler technique, and I hope it has demonstrated the importance of good inhaler technique in achieving good asthma control.